Hello and good evening. Welcome to another episode of Positively Positive. And I am your hostess, Susan Mintz. I always start the show by explaining what positively positive is. And it's an appropriate name for everyone and everything we do on this show. Episode. I like that so much more like a series. Positively positive includes every aspect of HIV. Everything, anybody, all of it is involved with HIV. Anyone, we want your story. We are a storytelling show. We're not a talk show. We are a storytelling show. Our guests will bring something regarding HIV to the show. It is personal, whether you're newly diagnosed. It could be you're a long-term survivor, a caregiver, someone with an organization, just a volunteer. Someone is our guest tonight who's been in the pastoral field. Anybody and everything involving somebody. If you have any aspect of HIV in your background, please call the number that's going to go on your screen and tell us and let us book you as a guest on this one-of-a-kind, never been done before show. And it's about you. It's about removing the stigma. It's showing the different faces of people who in the community are trying to do something, from Maine to Michigan to Seattle to Miami. We are streaming and we want your stories. That's what Positively Positive has been in my heart for 20 years. And I thank Campbell Health Solutions for seeing the vision and giving me the platform to run with it. The second part, before I introduce our amazing guests, and I use the word amazing a lot because that's what this show is about, amazing people doing incredible works in their community. I do want to give you a little bit about me. When the glasses come off, you know we're getting serious, so we're not really there yet. But my name is Susan Mintz, and my website is susanmintz.com. My email address is on there. I am best, I think, in the field of caregiving. My late husband, Dr. Jeffery Mintz, contracted HIV somewhere in the 80s from some partner. He was bisexual, the absolute love of my life. And for 25 years, I took care and gave care to this incredible man who loved me, but he did have affairs with men. And I had to make a choice in 1981 to abstain from a sexual relationship, but our love never changed. The intimacy probably became more so. But when he took ill in 92, he was gravely ill with pneumonia. And when I put him in the hospital on June 19th and June 19, 20th on 1992, I documented his journey through AIDS for 2 years. Decades later, I put it into a book. I isolated myself for 2 years, took my 15 journals, transposed them into an 8 by 10 spiral bound book. Years after that, we put it together and I published the book, Committed to Love. My own personal journey, a widow's journey through love and loss. If there's a little shadowing overhead, it's because of the light. And then I wrote a companion book called And I Held Their Hands with a Hospice Heart. Both books are 24 chapters each. They're stories. I am a storyteller, a story writer. That's who I am. If I meet you, I'm going to always ask you questions and find out why and who and what you are. So if you go to susanmintz.com, I would suggest you can check on the Positively Positive page for previous airings. Thank you, Nikki. And I would suggest you go to the books icon page. And if you're so inclined, at $22.95 each, you can pick up copies of my book. And I think there's an ebook on either Amazon or Barnes & Noble. I stream on Facebook, LinkedIn. We're on many streaming channels. But I just want you to know that these books that I wrote are so personal that they go through issues. I always said if you read the Bible, My stories are the book of Proverbs and the book of Psalms all together. I am an issue writer. I'm an emotion writer. I write because you've told me something that I could understand and relate to it on paper. So that's the story, Positively Positive. And these are the books, and SusanMintz.com is all you need to know. Now the glasses are off, which means we're intense with this. In just a few moments after a brief pause, you were going to have an incredible guest tell you about his journey, an incredible journey. I can introduce him by so many titles, but let's just say I'm going to start with Reverend slash Pastor Emeritus of Unity Fellowship of Christ Church in the city of brotherly love in Rocky, Philadelphia. I'm going to welcome Dr. Jeffery or Mr. Jeffery A. Reverend Jeffery A. Haskins into the studio. Hello.
Well, hello, Susan. How are you?
Hello, my friend. You know, there's so many things you've done, and there's so many titles and hats you've worn that I
Yes.
really didn't know what to call you. But I have so many wonderful questions. You are going to enlighten our viewers with your story, and I'm
Okay.
so proud to have you on as a guest. And no matter if we have a glitch or if we have
Mm.
a hiccup or we disappear for a moment, God is great. Praise the
Yes.
Lord. And we are
Praise,
doing something
praise God.
positively positive.
Yes.
You're wonderful. Now, I want you to take me on your journey. As I said, I love stories. And when I
Uh-huh.
went through your bio, not only you're a graduate of Howard and Columbia University, but the one thing I got from your bio that stood out the most is what stands out the most to me is your ability, I'm all chilled, and
Mm.
desire to help.
Yes.
That stood out about all your titles, all your community involvement, all your everything. You had the desire in your heart to help. Now, where are you personally located, and where did that passion come from? And take me on the journey from how you got into Columbia and all these other things, so many boards and community
Mm.
activism and Asian and National HVHS. I mean, I can't even go through them. You are. So
Okay.
talk to me, my friend.
Okay. I'm gonna take my glasses off since you took your glasses off, so we can have a real
Thank
conversation.
you. Thank you. Yeah, these are for show, just because we had to have a
Oh, I
gimmick. And I
know.
said,
And
well,
these,
I love
these,
to dress up.
these are for reading, but
This
I
is
don't
me.
think I'm going to be
And
reading anybody on here. So,
then,
I
whatever makes the guest also relax. But
Yeah, well,
yes.
it all started. It started from my birthplace. I'm born in Washington D.C. In a segregated town many years ago, where segregation was the way. And I was raised in I was in the colored person. I was born in Freedmen's Hospital in Washington, which is the colored people's hospital, where the colored babies are. And so from color
What's
to
the name of it?
Negro, yeah, color,
What was the hospital?
the Freedmen
The name of the
Hospital,
hospital.
Freedmen, Freedmen, for the freemen, people that were,
Uh,
coming to DC from the South who, after the Emancipation Proclamation, Reconstruction, and and the Great Migration to the North from the South. So my mother gave birth
right.
to me in Freedmen's Hospital. So there was a black hospital, there was a white hospital. So, where you had to go, where you had to be born. Um, and so the segregation started, and I was 8 years old when the March on Washington came, and my father had me there on his shoulder. And I recently gone to the 60th anniversary of the March on Washington with Reverend Sharpton and Martin Luther King III. And so the activism started in the city of Washington, D.C. Not only was it civil rights, but my mother had
But
me at the women's. Yeah, my mother had me at the women's rights.
how
Uh,
was it?
would you say?
How was it different when you were eight? How was it for 8 years old that March
So
on
68
Washington,
years.
and now that you were when?
Yeah, it's very different
How did
because,
you relate?
well, I related because when I was 8, all the men were on stage. The only woman on stage was Mahalia Jackson singing before Martin Luther King spoke. So there were no women speakers. This time, there were women speakers, and Al Sharpton made sure that it was intergenerational, that his daughters helped him plan it, and Martin Luther King III made sure that Martin Luther King's granddaughter spoke. He didn't speak as his father did. He let his daughter speak. So the youth, and I believe that I was conditioned as a young person in the movement of change because the youth movements, we saw the youth movement be international when George Floyd was murdered. And so the youth movements we saw just recently,
Right.
um, the abortion movements in both Kansas and Ohio, those people were young people in that room. Um, and, my work with young people, mentoring, and I was mentored as a young person. So
Mm-hmm.
that's where the passion comes. So I'm giving back to those who have I mentored in the past. And this is how I got to this program because my mentee is now running it and working with you. And that started a long time ago, years ago. So that's how I got to where I am
Yeah.
today with
I want to
advocacy. Yes.
and mentoring and advocacy and being involved even at a young age move forward. Once you start that feeling of knowing you have to be involved, you kind of automatically it goes with you. It grows.
Yeah.
And then how did you get Howard in Columbia? That's in Columbia.
Well, that's the educational part, what are you going to do? And so coming to Howard, since I was in Washington, D.C., I went to Howard. I lived 4 blocks from Howard, and Howard was the school, and I was in the business administration school. And then Columbia was theater, the arts, and I did theater management in New York. We ran an LGBTQIA company called Rainbow Repertory Theater, and in Manhattan on 26th Street, and we did basically plays because at that time, when I was in the 80s, there wasn't a whole lot of gay or lesbian plays being done. So we did our own theater company. And so storytelling, those are the stories we tell. Uh, and we still have those plays, and we're going to donate them to the Schomburg, um, and we're probably going to redo them, as I am seasoned in life and retired and can do whatever I want to do.
Yeah, you're always going to. But tell me also about some of the and some of the given and so many of the awards, or just tell me what you continue to tell me on your journey, all the different things.
Oh well, the journey has always been an
Because
ABC plan.
HIV,
Yeah, it's been an ABC plan, which started early as 19 years old. arts, business, and community. So I have worked in all three
Mm-hmm.
areas: public health. I've worked in the theater,
Mm-hmm.
worked and in the business and have my own business, the Haskins Consulting Firm. Even after retirement, I still have clients
Right.
that I work with. And I'm on committees that are making social justice change. Because that's my root. I come from
Right.
advocacy. I come from the church. I am a retired pastor and been in the church all my life. And in the churches I grew up in, it was about fighting for the rights of people. God is love, and love is for everyone.
Yes.
Didn't matter who you were, where you came from, nothing can separate you from the love of God. And so we believe that as the people that I associate with,
Right.
the people that I led, and the people I demonstrated with. And how I got really into HIV is in New York, and it was ACT UP. Uh, and at the time, we were fighting for uh, better medicines and for making sure we'd be seen visibly. Us that live with HIV, because I've lived with it for 30 years, and I've worked in HIV care and treatment, outreach, and advocacy for 32 years. So it's always been on the forefront of making life better for people living with HIV. And right now, the newest group, or a group that the first pioneers who are living 50 plus and working with National Minority AIDS Council and National HIV and Aging and Advocacy Network,
Sure.
we're making sure that the 50 plus, us that are aging,
That's the one.
we're not visible. We're going to be seen. We're
Yeah.
not going to be put out the pasture, and we're going to get good quality of life. We're going to get affordable housing. We're going to get food, our food secure,
Definitely.
and our mental health taken care of, all our health taken care of. And we're going to be in people's face about you. We've taken care of so many people along the way. Now it's time for the government to take care of. Or we're going to develop in the process developing our
Well,
own agency so we can take care of us.
how do you feel that we've progressed at a personal you see as far as HIV, the LGBTQ? I mean, I still don't understand why there's a stigma. I don't understand why we are not like we did when it was ACT UP, active, and we were making known and seen and heard, and why it's gone so quiet because of medications. I don't get that. I think we should be. I want people on, other people involved who are not afraid to show their faces and give a testimony
Mm-hmm. Well, I
and
think
witness.
we're at a
We want
we're
your
really
story. You.
well. I think we are at the point of change as we are in our society fighting for humanity and all rights right now. So, with the Older Americans Act that's going to be
Yeah.
reauthorized, the Ryan White Act that needs to be reauthorized, and the increases in HIV funding that this Congress needs to work on, we won't get it unless
Yeah.
we protest. We got to protest. We got to go back in the halls, run them up and down them halls, shut them down like we used to
That's
do.
it.
It's really at the point, and the most powerful tool we
Right.
have is the vote. Is the vote. And so if you want change, you need to vote for change. In Philadelphia, we've got the
Vote for
first
change.
Black woman mayor this week.
And the amazing guest
And
on, and he's back. We're back. Yay.
yeah,
When my husband, can you hear me?
yes, I can hear you.
Jeffrey, can you hear me, Jeff?
Yes,
Oh,
I
good.
can hear
When
you,
when my husband,
Susan.
it's great. when my husband took ill in 92, he was gravely ill. And the only
Mm-hmm.
thing they had was, certain meds that were AZT. But he was so
Right.
ill and he had 3 bouts with pneumonia and he couldn't do it anymore. But I swore to God in my journals, every day I wrote about it, I swore to God that if God got me through this with the love I had for him and the compassion I had for people, that I would dedicate my life, whatever door opened, as long as it was involving
Mm-hmm.
HIV, I'm going to storm through it. I'm not going to walk through it. And when I saw in the 80s and 90s, especially the 90s, where the mom and pops were active because it was their kids who were getting sick. So it was so much more big time, the mommy and the daddies. And there were groups there in the hospitals. There was so much support. And slowly,
Yeah.
I've watched the funding go, and slowly I've watched the activism go away. And slowly I've watched it go into the LGBTQ community, where you don't realize, honey, it's in the senior community. It's in the kids community, teenagers. It hasn't gone away.
Mm-hmm.
Medications are not still the issue that can keep you healthy, but you still can get infected if you don't get tested, know what you're doing, and don't. I mean, it's just going so underground for me that it's frustrating, because we need to act up, act out, and shout about it.
Well, I think we have the tools because we have the National HIV/AIDS Strategy Plan that President Obama put in place, and that even including the presidents after him are still working on it and keeping it going. So one thing about that is that we've progressed with medication, people taking their medicines and becoming undetectable. And so undetectable equals untransmittable. So people who are HIV negative, and we have, PrEP and PEP, and we have new, and we even have injectables for people to take the pill.
Right.
So education, HIV education, which I do trainings in, we still have to get the message out, because the greatest thing that we have to fight is HIV stigma. There is still the
That's
fear.
it.
There's still a fear, but we have all the tools in our toolbox to end the epidemic. And we have an end the epidemic plan for 2030 in the next 7 years. If we follow the guidelines, follow the strategy, and do the work in the community, then, I mean, someone HIV negative, if you're exposed to HIV and you're on PrEP, PrEP's going to kill it in the first 12 hours. So let's get this to the people, so the people won't be exposed to HIV. So the people will be aware that I need to be on this, and just in case somebody with HIV don't tell me they got it, and it can't be transmitted. It can't be transmitted sexually through the blood, but then we have other things that we our health system and all of our health. If we don't ask for it, we won't get it. To this week.
Yes. Yes.
And so
For sure.
our voices need to be heard, and they need to know we got the vote. And if you ain't gonna work with us, then bye.
Yeah,
Get out.
and it's not people of color. HIV is in every sector. It's in every
Yeah,
part of the country.
yeah.
It's not. It's still. I think, like I'm at my church. It's so wonderful to have a man of the cloth literally with me, because I am a member of an amazing apostolic and prophetic church in the Boca
Mm-hmm.
Deerfield area called Jesus People Proclaim Ministries with Pastor Billy Thompson. He used to play basketball with the Lakers and the Heat, and Prophet Cynthia Thompson. And it's about 90% African American Hispanic. But 20 years ago, God told me that's where I belonged. And what I know
Yeah.
is, though, that African American women are very high risk. And what would you
Very
say
much
about
so.
that? What would you
Well,
say
yeah.
about that?
Well, I mean, it started out in the beginning, Cosmopolitan told heterosexual women that they would not get HIV. The women of ACT UP had to storm the Cosmopolitan and tell him to refute that, because so many women were getting acquiring HIV. So now
Mm-hmm.
women who are living with HIV and the women I work with are the women who are powerfully saying, you need to give us more access to treatment, access to care, because you do it for the men, but you don't do it for us. So
That's right.
as the women are talking about reproductive rights and that men can control their bodies, they, as far as research, HIV dollars, and women specific needs need to be met, and only the women can speak to what they need.
That's
It's
right.
not for us men to do it. It's not for nobody else, government to do it. It's for the women to demand what they
The man.
need,
That's
as they
right.
did all this week and demand. And they're going to plan and demand and get referendums on ballots for next
Right.
2024 in states
Isn't
in
it?
this country. So they got to
Isn't that
demand
yeah?
maternal
Isn't
health.
that
They got to demand HIV health, other health things, cancer, breast cancer, all of the things we need.
mm-hmm. Yeah.
The
Isn't it
power is
interesting?
going to, hmm?
Isn't it interesting? And Virginia
Yes,
and several other
Virginia is
states off here, their
Maryland,
referendum
the
was that.
state that
They,
I grew
to
up
be
in.
exact, we vote.
Maryland, Washington, and Virginia are becoming progressive states. Pennsylvania is becoming a
Very, yeah,
progressive state. And Pennsylvania
right.
held the election. They were trying to blow up our convention center where the votes were being counted so that Trump would win over Biden. But it was not to be done because our police department in Philadelphia stopped it and Biden got elected. And so we know that the swing states and we know the people are for what is going to work best in their interest. And so I
Mhm.
still say the power of change is going to be the power of vote. And I'm going to be
It is
on the front line advocating for a
good.
better healthcare system, a better way of advocating, and a better way of educating people and letting them know that we can't be complacent right now. There's too many
Mm-mm.
numbers of
No, there's
infection
too much.
rate,
No, there's too much
and we
happening
can't
in.
be complacent
Uh-uh.
because
Uh-uh.
the Republicans are coming for the CDC, the Center for Disease and Control, and trying to cut
Yeah.
funds. We cannot be. We have to fight back.
Yeah, we are very powerful. The vote is very powerful, but you have to get on referendums. You have to know who your congressman is, your senator,
Hmm.
and if you know their rights, whether it's guns, whether it's abortion. I mean, you could run on just a couple of platforms right now, and you could get a lot
Right.
of things signed. And I really believe that the power of the vote this year, they say it every time, the power of the vote in
Hmm.
2024 is going to
Yeah.
determine our next perhaps decade because it is
Oh yeah.
turbulent. And the other thing, I love saying reverend or pastor emeritus,
Hmm.
but I love it because I think that the greatest failure of our country today, November 11th or 12th, whatever it is, the greatest fault is human rights because human rights
Hmm.
encompass all rights:
Yes.
abortion rights, voting rights, gay
Right.
rights, marriage rights.
Hmm.
Human, we have become dehumanized, if that's a word. I think the human spirit has been so demoralized because of the negativity that it's up to people like you and shows like and the people coming forth to tell their stories from all different walks of life are going to
Hmm.
be making the biggest difference because we are a face and a power and a force. And Richardo Jackson is amazing with what he's been doing with his podcast and his shows. But you have so much that you have done in your 50, 60, whatever years you are. You look great. And I like your
Well,
hair.
I'm 68 and I'm 18 months to 70. But I want to just say that love conquers, well, love trumps hate. That is a
always.
phrase we use in Philadelphia. Love,
Yeah,
Trump,
Trump's head.
hate. And
Uh-huh.
the
And
second phrase that we use for to keep ourselves encouraged, to keep our hope up, and to keep our faith going is that love conquers all. So we
oh, absolutely.
know that, and that comes from a spiritual realm in all the faiths. And we have
Yes.
interfaith work here, and I've been involved in that. And I know that the hope for tomorrow and the people who have been there and been the leaders before me, the Jesse Jacksons and the Martin Luther Kings and
And the Reverend
um,
Al, oh,
the Reverend
Reverend
Al
Al,
Sharpton and
amazing.
amazing Shirley Chisholm, Rosa Parks, all of
And
them, and my
yeah,
parents and my family and my community. We keep we keep fighting till we win.
and you know
And
who I
so,
really like? You know who I do
who?
like is that the attorney Benjamin Crump. He is not afraid to go front and center and be a
Right.
spokesperson for those who have been abused. And they give him a lot of bad press. I admire him because he is the face of those that are oppressed, being advantage of, disenfranchised. I give him a lot of credit for that. But there's a passage in the Bible, and I'm paraphrasing, but it says, "You have not because you ask not." You
Yeah.
will not get anything in this world unless you ask for it. Once you come out of your mother's womb, unless you fight, ask, demand, stand up, act up, you won't get it.
Hmm.
It will not be handed to you. That's why people like you are making the difference, because all of your 50 years, whatever it's been, and all the titles and all the degrees and all the boards you've served on, everything shows that you are a fighter for the rights of people, no matter whether they're a minority or they're in the
Hmm.
majority. Your
So I
community
think
service speaks for itself.
yeah, I think you said something. In the beginning of the program, I always want to help those less fortunate than me. And by helping
Mhm.
those less fortunate than me, I also help me in the process.
Yes,
And
yes, you
so
do.
when I look at what is in my community, in my city, in my state, in my nation, in the world that I am a part of, humanity, we've gotten lost from being human.
Yeah,
We've become
yeah.
we've become inept.
Desensitized,
We don't feel we don't feel our brother and sister's pain. We've got to get back.
desensitized,
Yeah, what? Yeah. And so
desensitized.
we got to get back to being human. Human. That's all
Yes,
it is.
you
We just,
and
and so
love humanity.
that's going to be some re-education, and speaking to that. Let's just be human in these situations. Okay, if we have the right to disagree, but we don't have the right to harm and destroy or abuse another human being. That is not how God
No,
created this human race. No. And
and
so
it's
when
it's
we
become
get
that.
there, we're not going to make change as long as we are inflicting pain, harm, and we're not listening to the other person's
Mhm,
point of view. So we got to have
mhm.
conversations. We've got to have
Wonderful.
coalition building. We've got to work together to change our
Together.
society. We've really got to start here at home.
Yes. And if there is a need, even in your little community, maybe there's only a few
Hmm.
thousand people. If there's a need, fill it. You know
Well,
there's
there
a
is a
need,
need
whatever the
always
issue,
in the community. Every
there's
day you
always
see
a
someone on the street homeless.
need.
What
That's
do?
it.
When they ask
But
you for change, when they need a meal, what do? Do we walk past them or do we assist or do we help? I
mhm,
try to, make sure I have enough loose change. I try to make sure give $1 a day so that next time I see them, they thank me and they're in a better situation. What about programs? I know where there's lunch around the corner. Go around the corner and get you some lunch.
Uh-huh.
Let me walk you around the corner and get you some lunch. I mean,
Yeah,
I
this
live in
girl says,
Philadelphia where we have Project Home, who is building affordable housing and getting homeless people apartments. So I'm
okay.
in a so if you're homeless here, you're lucky that you can get assistance, you know?
Yeah, Jeff, I'm saying that in a country that has so much, so many people are lacking. And that it just bothers me with transportation. My big issue is testing, of course, get on meds, resources, where to go get your information. But I'm a big believer transportation and
Hmm.
housing, big
Yeah.
issues in general. And you can't get to your doctor appointment, or if you can't get to the health department, what happens? You suffer. The more you suffer, the more someone else around you suffers. And that's what we've got to try to do is get people out of the victim mode and into the victory feeling. Your
Well, that's what you
victory.
have to develop. You have to give them the tools to be the good, to advocate for themselves. Everyone, you don't have because you don't ask, right? So let's get them trained to advocate for what they need. Let's let's make them not take no for an answer and say, I'm gonna keep at it till you give me what I need. You've
Mm,
already taken taxes out my money. You've already I know you got the resources, so put them in my community. That's
mm,
what we're out here on the front line fighting, and we're constantly fighting until people
mm.
get what they need, so that their health will be wholesome, so they can be a whole individual. And that's a spiritual principle:
It
mind,
is.
body, soul, finance, and emotions. This hand needs to be well. It needs to be well with my soul. And so if I can, you want to make the rules and tell me how to live, but if you're going to be the government and you're going to take care, then you got to take care of the citizens. So let's just fill the hand. Give me something to put in my hand that I can
Mm.
use to make my life better, my quality of life better, and I can live better. I can live healthy and whole. That's what we're advocating for.
Yeah, and I think most people want to feel like they are of value, their self-respect, that you
Mm-hmm.
matter. Literally, respect people. Even if you don't feel that love for someone because they just have something about them. We're just warehouses with the spirit. The spirit is what's important. I'm just a warehouse. I'm just a tool in the big world of things, bringing one thing to another. I'm just connecting Richardo Jackson with Campbell Health Solutions and you. I'm just a
Mm-hmm.
bridge, but I have a voice. And that's what I want to do is I want to see more people who even feel like they have nothing to understand that they have so much if that voice of self-esteem, self-respect, all of that comes forth. And that's where some of us need to take that person by the hand and say, you matter. This is where you can go for this. Know where your community resources are. And you get strength back in your body that you were supposed to have. We have to help others more and sisters more than ever. Not of color. It doesn't matter what's got to do with color. Though I do believe that, there's certain communities that definitely are hurting a heck of a lot more. But I
Yeah.
think you have to give people the reason why they matter because you are a living, breathing organism and you deserve to be treated with respect. And the only way that happens is if we all put it together again and get real in the faces of our politicians and say, you're not coming back for another term. You don't matter. We matter.
Right.
Jeff
We
Jeff
we
Haskins
have the
matters.
power. Use the power to make change. We
Mm-hmm.
have the power. The
Mm-hmm.
power is in the hands of the people. And if the people don't demand that politicians and other folks, and not just politicians, neighbors, um,
Mm-hmm.
human beings, that we do a
Right.
better job of treating each other with dignity, respect, and proper manners, then the world is not going to get any better. And so
Now and come
the
and
message is treat me the
mhm,
way you want to be treated. And I will
definitely.
treat you the way you want to be treated. And we'll both
It's so
treat each other with equity and equality and with love and peace. And then
eh,
we can all have joy and have happiness in our life. It's real simple. It's really
it's
the
not. Yeah,
principles
it's
that this
very
nation
simple.
was built on, the principles of our faith, and the principles of just being wanted, needed, and desired. That's real simple. And
And,
then your
and big.
psyche is wonderful. And we got to get there. It's going to take some work.
I think compassion, Jeff, is a word we don't use enough either. To
Hmm.
feel for the person. I meet you on the journey. I don't have a history with you. I read a bio that's 5 pages long. I mean, it's incredible what you've done. Like I said, I read it and I went, oh no, there's no way if I introduce him, it's going to be a whole show. But I know one thing though, compassion is missing from our life. Looking at someone where we are, I have now a history with you. I have a present with you. Where we go in the future is one thing, but I don't have meet people where they are on the journey.
Yeah, and,
It
and
works.
and and you're saying the same thing we say at the Philadelphia fight, and the word fight is there for a reason. Fight community health centers. And when we started in this journey with the AIDS epidemic, pandemic in the world, we definitely wanted to be clear that we meet our participants, not just the patients that go to clinic, but the ones that come from prison back in society,
Yeah.
and the
So
ones that are pediatrics and family care and the dentistry and all parts of the A to Z one-stop shop. We want to meet each person because it's about personhood. We want to meet each person where they are. But I can't access where they are unless I listen to them telling me from whence they came because it's their experience. It's not me regulating. It's not me telling them what's best. It's about me doing harm reduction. And it's about me lifting them up so that they can get their needs met and they can be a better person when they leave this agency and walk out the door and go back into the world where they may be traumatized or where they may have a crisis situation. But if we can educate them in our TEACH program, which stands for Treatment, Education, Advocacy, Combating HIV, if we can give them the tools and the power, then they will be okay when they're out there in that world that doesn't want to see them, wants to disenfranchise them, wants to marginalize them, wants to treat them like they're not worth being the person they are because they're right. Because if they were born into this creation, they have the right to be a person, have personhood, and have their needs met. And that's real simple. And that's what we do.
well, I can see where your passion comes from. You're tireless. And that's so important because I think, I always say you don't choose your message chooses you. You can either
But that's the
accept it
story. That's the story.
or not. I mean,
It's
when
the
my husband
story.
took ill,
And so if you're
he
gonna if you're gonna come from my culture, if you're gonna come from my culture with the griot from the African culture, if you're gonna come from my culture, we tell stories through our culture so people
right,
can take the information in, empower themselves, and make their
selves.
life better. It's a
It's
very
one, and
old method of doing it, and many other cultures do it. It's not just the African culture. I've
yeah,
seen it done in the Jewish culture. I've seen it done in the Latino culture. I've seen it done in
uh,
the transgender culture. I know it's humanity and people again. People will always, if they're good, always look at ways I can help somebody else. I'll take care
yeah,
of me,
right.
but I'll reach back and help somebody come where I am. And we'll
I am my
share
brother's
together.
keeper. I am my brother's keeper, whether I like my brother or not. I'm called to love. Love is a
Yeah.
different dynamic. What I wanted to say is when my husband, I loved him dearly, and I still do. I've been a widow 30 years. But when he was was a bisexual, very promiscuous, very handsome, very promiscuous. There were no other women, but he was promiscuous, and I knew though that God told me to stay with this man and love him. And no matter how hard sometimes I might have wanted to get away, I had no place
Hmm.
to go because I knew in my heart it was an assignment. I was to love this man till death do us part. And after he passed, I probably could have gone out into a lot of singles groups. I was 48. I probably could have had
Hmm.
other things I did, but I didn't. I'd stayed true to the cause and the commission God gave me. HIV is my world. I want to be in it. I want to live it. I want to talk to
Hmm.
people about it. And I want people to know you matter the most right now. Right now, I'm talking to you and me. We're talking to
Yeah.
each other and we are giving out so much good information. You are a treasure, but you are so passionate about what you do that nothing could stop you. You're amazing. I'm so glad we didn't get into the board things and all this, what you do, but you got into the
Yeah.
activism and the spiritual part of it all. Spiritual part of it
Well,
is
I
so
mean,
important.
I think for 41 years of this epidemic, we have learned some lessons. And the lessons we have learned, we know what works and what doesn't work. And
That's
so
right.
we've come up and created a plan to end the epidemic in our lifetimes. And so we're going to keep working on that. The health department's got the plan. The politicians got the plan. The federally qualified health centers got the plan. It's a national HIV strategy to end the epidemic. And so when I sit on those other committees, we're talking about what is the progress we've made. We've made progress with having people be undetectable. We know where
Mm-hmm.
we need to make other progress. And the other progress we need to make, we need to get more people, women, transgenders, people of color, people that are marginalized, and the poor people on PrEP. We need to have PrEP more available. We need to have
Yeah.
injectable medicine for those that have
Yeah.
pill fatigue. And so there are ways to help people do better. That's
Yeah.
our work. That's what we got to do.
Yeah. Yeah. The issue when I talk about transportation is you can't though get certain things unless you have the availability to get to the place. I know even in my
Well,
area
I
in
mean,
Palm Beach
some
County,
agencies
Palm
are
Beach
going
County,
to the people in rural things. So I know
there you are.
transportation, transport planning, people planning, prevention planning groups are moving money from groups that have been underspent as they've gotten the money into transportation across the nation
Hmm.
because we're trying to improve that. We understand that about transportation,
Yeah.
but there is a plan.
Right.
There is a plan to get people in rural areas who don't have the necessary transportation, but get the transportation to them. Give them some more money through the Ryan White program
To
so
them.
that so the agencies can get a 15 passenger van and get to the people. And that is happening.
Yes.
So you have to
Yes.
also, I know the barriers, but I'm saying we have to give credit to those on the front line and those on the ground that are fighting the barriers and making change
Yeah.
because change comes in small increments. It doesn't come fast.
There.
It takes time.
No.
And so I know that that is the subject, just as housing is, just as transportation is, just as access to care is. We keep saying what it is, and now what we going to do about it? That's the question that
Yeah.
needs to be answered. And what's the
We know
plan
there's a need.
to remedy it?
Yeah. We know there's a need. How do we fill it? We know there's a void. How do we empty it? And how do we fill it up? It's really not that hard. I don't know if you've been in Palm Beach County. Palm Beach County has Boca Raton, which all you see as you think about is money. Not true.
Right,
Then you also have Belgrade, which is a more impoverished area. It's a
right,
diverse county. huge
Is that
county, but it's
Florida?
very
Is that
diverse.
Florida?
It's yeah, Palm Beach County, Florida.
Right.
Yeah, Palm
So
Beach County,
I'm on
Florida.
panels with
It's
people from
diverse.
Florida. I'm on
It's
panels with
huge.
people from Florida that bring the same problems you bring to the meetings. And when we get in the meetings, we come up with the solutions. Because the thing about community organizing is that community people, if there had not been community organizing in the bus boycott in Alabama in 1950, whatever, there would have never been. So if there hadn't been community organizing around policing and putting your knee on George Floyd's neck around the world, there wouldn't have been no change. Police departments are held accountable now. So
They are.
I'm just saying, what are the strategies? People with power have to come up with their strategies of how they're going to get people, the change makers, to make the change.
Mm-hmm. And
Act Up did
one,
that. Act Up, we only had AZT, and then we chained
yeah,
ourselves to death. We got arrested. We went in the legislatures of every city, state, and we would not move until they gave us more medicine. That's how we got art. That's how people started
right.
living and not dying. So
Yeah.
it's the same strategy. The women had to do that with the Now movement, the National Organization of Women. That's how they
Mm-hmm.
got more equal rights. So I
Yeah.
mean, the strategies work. Organizing and community organizing, they've all worked before. Why can't we use them again and work them?
You have energized me, and I thought I had energy, and I would. You have excited
Well,
me
I
to
don't
do
want you to
more.
quit. I want you to keep on doing what you're doing. I want
Oh,
Richardo to do what he's doing because he came and sat as a youth and learned this from
so you're a
in
mentor.
New York City. There was always advocacy. He didn't just learn it
Yes.
from me, he learned it from the agencies he worked with. And he had a passion in there to do something as a young person. And I told you, all the movements start with the young. The young have the energy to do it. So,
Mm-hmm.
us that been out here, it's time to move back and let the young come with their energy and lead it and make the change. We've done our time. It's our time to step
No.
back and support them
Uh-uh.
with moving the agenda forward. If we know the
Right.
agenda, let's come up with the
Right.
agenda. That's the work we got
But
to
I
do.
think that, but sometimes I think the wisdom that we've acquired, you are so committed to what you do. You bring people in because of your passion. But I say, as we get older, if we are entrenched in a cause, if we do believe in
Mm-hmm.
it, if we never give up on it, that we all are trying to make the significant difference. But unless you have the passion for something and you stay committed, you won't get the results you want. If I wanted to give up on HIV, I wouldn't be here with you now. I wouldn't have my books. I wouldn't. But when the Lord told me to stay with HIV and reach out to those
Mm-hmm.
who might be in need, I stayed true to it. It's not easy. You think even Richard, when he and I met, when Richardo and I met, it was instantaneous chemistry for the passion to help our community. And he had the structure with the platform, and I had the ability to be able to talk and interview people. I love it. This is the best thing I can ever do is to talk to people and find out how did you get from where you were to where you are and all the stuff in between. The journey.
Well, it's a calling. It's a calling. I was anointed, appointed, and assigned this work.
Right.
And when I did the outreach in Harlem, or did the outreach in Brooklyn, or did the outreach down at the pier on Christopher Street in New York City, I knew that, and I lost a partner too. I've lost two partners, one to HIV and one to suicide or murder. They still haven't figured out what that is, but still, the the ills of our society are the phobia, the fears, the stigma. Those are the things we fight. Those are the things that keep people from getting what they need. And they're entitled to it in a right as they are born person and God has created them. They have a right to what is in the world. And until they
I love
recognize that, until
is
we
that.
teach them that,
Mhm.
till we empower them with that,
Right.
then they will go get what they need. And that's been the practice I've seen. That's why I still
You
stay in
know,
education. That's why I still stay in training. That's why I still stay in advocacy because I've had to do it myself. And that's the real
yeah,
story. I've had to
right.
advocate, and now I got to advocate for me at at this age, going towards 70. They don't want to see me. They old G old head. Um, they don't the young. It's a youthful society. Us that are aging, they want us to go be put out in the field like you put a like you put an old bull or old cow out in the field. They
Jeff,
want us to be
Jeff,
invisible. I'm not going to be
no,
invisible. I'm going to fight
no.
for the rights of my generation to be seen and not be invisible.
Jeff, I'm 77 years old, and I think I'm just beginning on
Yeah.
life on what God wanted me to do. 77, and I've never been more spiritually up, men
Mm-hmm.
focused, physically, and some issues. Emotionally, I'm a very emotional person, but I know that God's not done with me yet. And part of it is my age is a benefit because I have the young people in my church. They look at me when I walk in. I'm a Two Testament Jew. I am a Jewish believer, so I call myself a Two Testament Jew. But I know the little girls who
Yeah.
they look at me when I come to church. They listen to me when I speak because they
Yeah.
have their gifts to give. But the seniors also have their gifts to give in this world.
Well, that's
Some of
why
us are not put.
the elders and the youth need to work together and those in the middle. So from the beginning, middle, and end, if we work
And
together as a community, common unity, then we'll get the job
yeah,
done. Yes.
yes, it's really not hard. It's really much easier to love also than to hate. I don't understand where all the
Yeah.
hate comes from. I can get angry and I can get a little bit upset, but hate, I don't understand where that hate spirit really comes from. And I never will because I never had it. I do get angry and I have a temper and I will fight for people, but I don't have
Right.
that anger in there that comes out now. It just flows out of people so effortlessly. And I don't understand, though
Uh,
I do
you
understand.
know,
It is part of ISIS.
I do
It's a part of our
understand it
culture now.
because I understand it's very simple. Anger leads to rage, and rage leads
Mhm.
to violence. And if you don't address the
Yep.
anger when it first shows up,
You'll never.
then it's going to go to
Yeah.
rage. And once it goes to rage, you're out of control. And the violent stuff you will do is because you didn't take care of the stuff, the feelings, the rage, the stuff you were feeling
You.
like you didn't
Yeah.
get help, you didn't ask for help, you didn't tell somebody I'm feeling this way. You didn't so you're out of control and you're doing harm to other people. And
Yeah.
I don't want to ever be that.
Now, along the way, where did that person need the help that they didn't get? And where did they become who they are to be so hateful and angry? And that's what I don't. I do understand that obviously the society we're living in, but I do think the voices for change, the voices to stand up for those that have little, don't have much. I think there is hope for those who feel hopeless,
Mm-hmm,
help for those that feel
mm-hmm.
helpless, and a voice for those that feel they don't have one. You do. I'm always, yeah. I mean, I point that little Jewish finger at people. I go, you have power, even if you
You
feel
have
you don't,
power.
or you're down the
And keep
street.
telling them that. Keep telling
And I
people they
don't know
have
where you
power
might go.
so they enforce their power.
And
You
I don't
have
know.
power.
Maybe
That's
today you
it.
are down,
That's the phrase.
and maybe
You
you
have
don't
power, now
feel
use
like
your
you're.
power to make
If you're
change.
on the street or what I'm going to say is, even though you know today you might be on the streets, do you know in 10 years you might don't treat the person where they are, but treat the person where they might be able to
Hmm.
go. I can't help it if you all of a sudden you're living in that cardboard box on the street. But you know what? A kind word, help to a resource place, a drive to your doctor, a kind word. 10 years from now, you could be a multimillionaire doing what you want to do. We all
Hmm.
have second chances. It's a matter of second chances are powerful, but you have to have them. God gave me a second chance when He kept me well through my husband's illness and everything. I knew that was my second chance to help people at life. And what's more important than helping people to feel like they have life and they matter? So I
Yeah,
want to say to
I
my
mean
guest,
that's
I
the
want to
work we are
say,
put on the earth to do. We are to love God, love yourself as
love
you
it,
love God,
love
and
it.
love your neighbor as yourself. But first, you gotta love God. Second, you gotta love yourself, and third, you love your neighbor. You can't take care of nobody else
So
till you take care of yourself.
if you, I want to
And that's
say
one of my
Jeffrey A.
sermons I've preached many times in my pulpit and in my church, and I
Oh,
practice that as my
you're
life.
good at this. I want to end up by saying
Hmm.
thank you,
Oh,
incredible
you're
guest,
welcome.
Jeffery Haskins. How many titles this man is wearing? Ugh, amazing, amazing man. And thank you all for watching another incredible episode of Positively Positive. And stay tuned because there's going to be one constantly going because we've got people in every walk of life who want to tell their stories. If you have a
Mm.
story, you contact the telephone number on your screen and you call Campbell Health Solutions, and we want to make your story known. Thank you again.
Well, thank you for having me. You're doing great work, and both you and Rashida. And I was honored to be here to share with you in this moment and at this time.
God, it was great.